the session today?
Sure. Yeah, so hi everyone. My name's Dr. Tehseen Khan. I'm a GP at Spring Hill Practice. Thank you for joining us today on this cold Thursday evening to learn more about the vaccination. And I am joined with Dr. Ellen Schwartz, who I'll hand over to introduce herself.
Thank you, Tehseen. So, hello everyone. I'm Ellen Schwartz, and I'm a consultant in public health medicine at the City and Hackney Public Health Team. I've just recently joined, but I actually spent some time in Hackney about 10 years ago. So I do know the place very well. I lived there too. Thanks, Tehseen. And back to you.
Thanks, Ellen. So we're really excited to be here talking to you about the COVID vaccine and to help address any questions or any concerns that you might have. I've done quite a few, and both Ellen and I have done quite a few of these kind of events across London and across North East London, as well as City and Hackney. And I always learn something new each time I'm at one of these events. And I think it's really valuable to have the opportunity to talk to our residents, because I know there's lots of questions about the vaccine. There's lots of questions about COVID itself that I think causes a lot of fear in people, understandably, because you can't escape it. It's always on the news. And equally with the vaccination programme, people have concerns about it. People want reassurance and want to be heard about some of their concerns. It's an ever-changing programme, and you will have heard the news recently about some of the changes. So our role here is to address any of your questions at all. We're not here to convince you to have the vaccine. I mean, I see my role, and I'm sure Ellen agrees, is to try and inform you with balanced information as best as we can. And then that allows you to then make an informed decision about what's right for you. Obviously, we'd like you to have the vaccine because we think that that's the best way to protect yourself. But overall, this is an information providing session. We're doing 3 of these sessions, and today's session is around helping address those questions around people that have underlying health conditions, working out whether the vaccination is right for them. So we'll be answering some pre-submitted questions in this session, and we'll invite you to submit questions during the session too, using the Q&A box, which you should be able to see, and we'll try and address some of those questions as well. So with that, I'll hand over back to Dr. Schwartz, and she'll go through all the sort of principles and recent developments. Thank you.
Yeah, thank you, Tehseen. So I just wanted to talk to you a little bit about what's happening in the world and here in England and indeed in London before we go into the question session. And as Tehseen, you said, I think I really look forward to this, because it is through your questions that we kind of learn more about what people's concerns are, and we learn how to address them. Basically, what elements are the ones that really you want to discuss. So, as you are all aware, there is this new variant that was first detected through the sequencing of the genetic genome of the virus in South Africa, called Omicron, so little o in Greek. And this is now spreading quite rapidly and is being detected in all sorts of countries. So twice a day when you listen to the news or look at some sort of news, there are more countries joining that club of those who have detected it. In England at the moment, we have 42 cases. In London, last time I looked, 9 cases. We don't know a lot about Omicron yet. We know that it has lots of mutations, both on the outer surface as well as inside the genome of the virus, that it transmits very, very rapidly. We know that, but we don't know much about what kind of symptoms it produces. We don't know much about the severity of the illness it causes, and we don't know how much the vaccinations, the current vaccines, are effective towards it. So that's kind of just setting the scene about this Omicron variant. It is still going to, if you look at those 42 cases, still very rare in London. And we are dealing at the moment with a vast majority is this other variant, the Delta variant, that is, causes about 99% of our cases locally. But currently in London and in the UK, cases are rising. We have had a lull over the recent few weeks, but now we're definitely in a kind of between 10 and 20% increase on a weekly basis in terms of the incidence. But at the same time, we know what to do to limit the spread of the vaccine. And I wanted to just talk you through those 4 key things, key messages that are really important to remember. The first one is, if you feel unwell, and that's really kind of any mild symptoms, please stay at home and have a PCR test to basically rule out that it's COVID. And if you do test positive, you have to obviously stay at home and ride it out. Stay safe by kind of continuing to do the hand washing, wearing of masks in crowded places, keeping a distance where possible, and letting fresh air in, because this virus is an aerosol and we need to just make sure that the air is circulating to get rid of it. And then the reason why we're here today, get vaccinated. To have the COVID jab is the best way to protect yourself from severe illness, hospitalization, or death. And that's what they were made for. But also get your flu vaccination this winter. And finally, the 4th of the key messages is continue to test even if you have no symptoms. So if you go into work or you go into a sort of social setting, test with a lateral flow test, or test regularly twice a week if you're somebody going to school or going to work regularly. Just keep testing to identify those asymptomatic infections, and then to be able to take yourself out of the circulation, stop the virus from spreading further. So that was the little intro I wanted to give, and hand back to you, Tehseen.
Thanks, thanks, Ellen. So with that, we can move on to the pre-submitted questions and answers. I can see some of you have already started using the chat function. You can submit questions and answers in the specific Q&A box as well. But either way, I'll keep an eye on both the chat and the Q&A box, so whichever one you're comfortable with. So the first question that was submitted was someone that said that they were worried about the vaccine affecting their long-term health. How do we know that the vaccine is safe for us when it is so new? And I think that this question comes up very frequently, right from when we first started rolling out the programme, and I came on one of these webinars back in January, and we had people asking the same question. I think it's a very valid question. That the vaccine was developed very quickly, within a year of COVID being identified, and people were kind of questioning why it was developed so quickly. And I think what's important to remember is that the technology around vaccinations is very old. So we've had vaccines for decades, and so we knew how to develop new vaccines. And because of the previous SARS outbreak in the early 2000s, actually we also had specific technology in order to scale up vaccination production for coronaviruses. So the technology was there. And then because the way that COVID affected everyone across the world, there was a political will, and a will that focused everyone's minds as the top scientists from the world started focusing on trying to make a vaccine to protect people. And so a lot of the red tape that normally is part of technology, whether it comes to new medications or vaccinations, that normally waste a lot of time submitting papers, go to meetings, etc., was all shortened, and it was squashed down to a few months. And also, a lot of trials end up spending a lot of time recruiting lots of people to actually test the vaccine. And in the COVID trials, actually, they managed to get a lot of participants very quickly. So I was a on the AstraZeneca vaccine trial, for example, and I got my first dose in May 2020. And alongside me, there were tens of thousands of people from different backgrounds, different ages, all across the world willing to try this vaccine. And so they were very quickly able to produce vaccines that were safe and effective to use. And so there was a lot of testing during the trials on people like me. But then actually when we started implementing the vaccination program, there was a lot of monitoring of what real life vaccination was like. And we've had what we call the yellow card system, where any side effects that are severe, any problems with the vaccine have been monitored really closely. And so that's how we realized that things like the blood clot issue with AstraZeneca in younger people, a very, very small risk of blood clots, but a risk nonetheless. And because of that, we then changed the vaccination program and back in around April, May time, where we only then offered the Pfizer vaccine to those people who are most at risk of a blood clot under the age of 40. So there have been changes, and there have been things that have been stumbling blocks, but it's been tested on so many people. And actually in the UK alone, we've given 116 million vaccines already, and all of those are monitored, and any side effects, any sort of safety issues have been highlighted. Just very briefly, the other recent safety issue that you might have heard of is this risk of heart inflammation with the Pfizer vaccine. Again, a very rare risk, but a risk that we've acknowledged. And so the guidance has changed. And so we are monitoring that really closely and making sure that the vaccine is as safe as possible for people. And the last thing that I want to say is that, yes, there are potential side effects from the vaccine. And I think one of the important things to say is that, you can feel unwell for a few days, you can get side effects, you can get a sore arm. And I think it's important to say that so that people, so that you know to expect that. But the thing is that what we were up against was COVID itself, which was causing so much disease and so many deaths. Nearly 150,000 people have died from COVID since it first started. So, and actually, if you look at how many lives have been saved, I think in September it was around 120,000 lives have been saved already because of the vaccination program. So that was a very long answer to the question, but I think it's a very important question, and it's one that is being asked very frequently. But in summary, the vaccination program has been really successful. The vaccine is safe, it's effective. And you look at the data and that demonstrates how safe and effective it is.
Thank you, Tehseen. So just to add to what you've said, if you look at who is in hospital at the moment on kind of ventilation devices or fighting for their lives, those are the ones who are the vast majority either unvaccinated or partially vaccinated, or have been vaccinated at the very early, kind of in the beginnings of the vaccination program, and their immunity has waned. So we have some very kind of concrete evidence in terms of the outcomes that this vaccination works. I'm going to address the next question here, which is, should everyone get a flu and COVID vaccine if they have an existing health condition? Is there anyone who should not get either? And the answer to this is yes. So it's particularly those with underlying health conditions who we want to have a COVID vaccination and also COVID booster if they've had their first and second vaccination now, to be maximum protected going into the winter. And we want you also to have the flu vaccination. This can be done on the same day, either in two different arms or even in the same arm. It's always possible. The kind of individuals who are not advised to have it are very, very, very few. So if you're concerned, you should speak to a health professional who knows you and who knows your underlying conditions. But in the overwhelming majority of people with underlying conditions, yes, please get your booster, or if you're not unvaccinated, get your first jab so that you have some level of immunity that will help to prevent severe illness or death. Tehseen, over to you.
Thanks, Ellen. So the next question is about someone being told by others that the vaccine will change their DNA and whether that's true. And where's the best place to get hold of information on studies on the coronavirus vaccine? So again, this is a common concern that people had. With the Pfizer and Moderna vaccine, it was a new technology. It's a technology that we've known about for decades, again, but it's the first time it's been implemented. It's been a really exciting technology, actually, because it has implications for other diseases that we're trying to beat, so things like malaria, for example. And the way that it works is by instructing your cells, your blood cells that fight infection, to make some proteins that then release a specific protein that the immune system recognizes as being from a COVID virus, so that then your body produces enough antibodies to be able to then neutralize the virus if you ever come across it in the future. So it then, that mRNA, so a part of a genetic material, then it degrades within your body. So it never passes into your DNA. It never passes into your cells. It never changes your DNA. It's merely a mechanism or an almost a transport vehicle, or almost like a car that instructs your body to do something, and then the car disappears. So it does not integrate within your DNA. And it doesn't cause any long-term impact. And actually, what we're seeing is that people tolerate it really well, and actually it's really effective. And it's helped us, this technology, I think, will help us for other diseases in the future.
Right, next one. We're just gonna, maybe we're mixing it up at some point a little bit, but this next one it takes a different tack, which is, I think, very good. And that is, I'm a Black individual with underlying health issues. What is the safest vaccine for BAME individuals? So first of all, there is concern about sort of people from Black African backgrounds because of low vaccination uptake. And in the first and second wave last year, we observed that the rates of illness and mortality amongst people from these backgrounds were higher. And that then shifted, and we saw similar kind of concerning patterns within communities of South Asian background. And so that is multifactorial. There's so many different elements likely to play a role here. Levels of exposure due to jobs, underlying health conditions, living conditions that just make it simply more likely that people from specific backgrounds are exposed to the virus. So that, first of all, why there was a lot of emphasis and there was a lot of outreach, whether in Hackney or whether anywhere else in London, to engage with people from Black communities to make sure that we have a discourse, a conversation about this, because we are concerned that there is another moment that there's more illness and death from those communities. We want people be vaccinated. And there isn't a vaccine as such that is more effective in any ethnic community. So most of the vaccines are given by age group. So now this is becoming a bit more straightforward too, that the booster is often a Pfizer or Moderna, even if the primary vaccinations were of a different kind, because of emerging evidence that mixing vaccines is increasing their effectiveness, and also Pfizer and Moderna, due to their mechanism, are very effective. So to your question, just because you come from a particular ethnic background doesn't mean you need to have a specific vaccine. It really depends on those factors. What did you have before? If you had a first one, how old are you? And are there any other risk factors we want to take into account? But that's about your individual health. That's probably for that question.
Thanks, Ellen. There's a couple of questions in the Q&A. I'll quickly answer them because they're relatively short. So there's one from PN saying that they're waiting for Novavax and concerned about blood clots due to history of varicose veins and poor circulation. How likely is it that Novavax will be introduced this side of Christmas? So we don't know the answer when Novavax will be introduced, but just to reassure you, there is no reason to avoid either the Pfizer, the Moderna, or the AstraZeneca vaccine, even for that matter, even though we're not giving that as a booster. To avoid any of those, if you've got a history of varicose veins, they are absolutely safe to use. And those kind of venous blood clots, the ones that originate in the veins, are not the ones that were picked up in the some cases where younger people had AstraZeneca. So please be reassured that you are okay to go ahead and have the Pfizer vaccine or the Moderna vaccine. I would have them as soon as possible and not wait for the Novavax, just given where we are with the high levels of both Delta variant and the emerging Omicron variant as well. And then the other question, again, a very quick one: vaccine safe on antidepressants? Absolutely no interaction and no evidence of interaction of that. So yeah, I'll hand over to you, Ellen, for the next question that you want to take.
Thank you. So the next one I'm going to take is: the risk of falling ill drops if you are under 30. So why would it be encouraged that a healthy 30-year-old would take a COVID-19 vaccine? So that is a really interesting question. And I think it becomes even more interesting now that we are beginning to vaccinate children. And so there are various elements to discuss. First of all, even if the majority of young people, and not necessarily this age group of under 30, but kind of children, have mild symptoms, some do have severe symptoms, and some become seriously ill. And the other thing is this kind of syndrome body of long COVID, so a combination of sometimes quite severe signs and symptoms that can lead to really, really a severe impact on your ability to function, with tiredness and muscle pain and a kind of vast array of symptoms. We are still on a learning curve for that. So it's really also, although they are in itself quite rare, as these viruses, or this virus and the mutations, go rampant through our millions of population, that relatively small proportion of people who develop long COVID can all of a sudden be quite a significant number. So throughout the UK, we now have, the health system has stood up clinics to diagnose and support people with long COVID in response to the fact that there are thousands and thousands of people who need that support. So the other issue about the under 30s is that if you are vaccinated, although you can still harbor the virus and pass it on, the likelihood is much reduced. It's reduced by about 40 to 60%. So the likelihood of you having to, taking the virus back into your family and, grandparents or vulnerable people is reduced. So some of the reasons why we give it to younger people are to reduce transmission, and to basically make sure that we can live with this virus in the future, relatively kind of hindered by all these repeated interventions. So that's why we're doing this. And it shows, if you look at countries who have introduced vaccinations in young age groups earlier than we did, that it does reduce transmission, and they've been able to keep their health systems going to a better degree.
Thanks, Ellen. I'm going to probably try and take another few short questions again in a row. I know, Joanna, you asked in the chat around being increasingly concerned about unvaccinated residents in Hackney and whether we think that the government will make vaccination mandatory. I share your concern. So both Ellen and I look at the data of how many unvaccinated people there are in Hackney, and our uptake is around 60 66%. So that means that quite a large proportion of those people who are eligible for even the first vaccine haven't come forward and had it. And that worries me because, I mean, I worked in the COVID clinics last winter, and I haven't seen anything like that in my professional career as a GP. The number of people that were coming in with shortness of breath symptoms and just not able to breathe, that they were coming to the clinic, or I was doing home visits on them, and they were so sick and they were getting really sick really quickly, and the impact that had on the paramedics and the ambulance service, and then the onward impact that had on the Homerton and other hospitals around London. They had paramedics and ambulances coming from Newcastle and places really far away, because actually London was not coping in January. So part of the reason why I got so involved with the vaccination programme is to avoid, I don't ever want to see that. And I'm sure my colleagues that lived through that share that sentiment. So I agree. I think that it's a real concern. In terms of the mandation, that's up to the government. I'm not sure that necessarily for the general public that mandation always works. I think there's lots of ways of trying to convince, and things like question and answer webinars just like this are the ways that we're trying to reach out and particularly talk to those people that are yet to even have their first vaccine. I'd prefer to do that rather than necessarily going to the mandatory vaccination route. However, as you'll know, that social care workers and soon healthcare workers, there will be mandatory requirement to be vaccinated, because they have a public duty to protect their clients and their patients as well as themselves. And just to address some of the questions in the other sort of in the chat, I mean, I don't recognise the data that's been put there or the links that have been put there. I mean, the mRNA technology is very exciting. I think that it's, in terms of the data and looking at how effective the vaccination programme has been, I think that the graph that is really striking is when you look at the number of infections versus the number of deaths. And we're not out of the woods, and any deaths from COVID is one death too many. But if you look at the first wave, when we had lots of infections, and the second wave, when we had lots of infections, we also had a lot of deaths. So about over 1,000 when we were peaking the amount of infections. What's interesting is if you look over the past few weeks, we've actually, and months, we've had quite a lot of infection, but that doesn't translate into as many deaths. So we've probably averaging around 150 to 200 deaths. Again, too many. I don't want to see that. But what we're finding is that link between infection and very serious infection and death has been weakened because of the vaccination. So that is proof that the vaccination programme has worked. That's a proof that it's effective. That's a proof that it's protecting our residents. And that's why I'm so passionate in getting this message across and trying to convince people, particularly those people that haven't had their first dose, to come forward. There's lots of different reasons why some people haven't had their vaccine, misinformation. I think that's a huge part, but also trust. And I think some people, for various reasons, and sometimes justified reasons, don't trust whether it's the government or the NHS. And I think one of the learning experiences for me has been around some of our underserved communities, exactly as Ellen mentioned, some of our minority communities, some of our deprived communities, around how as a health service we need to work better in the future, even beyond the COVID vaccination programme, in trying to address some of the health inequalities that exist within our borough, but across London and across the country. So this, I mean, it's been said repeatedly, but COVID and the vaccination programme really has shone a light on some of those inequalities. And I think that's something that's a challenge for us and how we can address that going forward. So protecting the population and the residents in Hackney is a really important task that we have. And I just hope that more people do come forward for the first vaccine. Thanks.
Yeah. Completely agree. So just a little bit of reflection on some of the conversations that are going on in the chat. So as I said before, these vaccines were designed to prevent severe illness, hospitalization, and death. And the view, it's actually quite simplistic, because the first and second wave completely overran our health system. And if you remember Bergamo in Italy, but also shortly after the UK, with tens of thousands of deaths, the only crude measure that we had then was a lockdown, basically keeping people apart. Some of the kind of learning from that is still in place, and that's why I kind of talked to you about those 4 key messages. And they're basically kind of mini versions of behavioral changes to make it less likely that we get infected or pass on an infection. But last year we had this sledgehammer approach, lockdown, social distancing. And then, of course, the consequences of the pandemic became very, very painfully obvious around the economy, education, and impact on our children. So what is the middle way? And if you had asked me last spring of 2020, whether it would be likely to have a vaccine, I think all of us were quite hesitant about that. We were hoping that it would be a possibility and quick enough. And I think we were all quite relieved how quick. And that's on the basis, I think that's what we didn't say before, of decades of research where these vaccines were actually modeled to target other things. So, for instance, the Pfizer vaccine was actually developed to be a vaccine for cancer, and it was then kind of remodeled. But it's not that they have done all that research in kind of 6 months. This is decades of research on the underlying technology. But just to say again, even if you're vaccinated fully with a booster and everything, you can still harbor the virus and you can still pass it on. That's why it's so important to still keep those other 3 messages and behavioral advice in mind. I hope that's given you a little bit of perspective on that one. Then I'm just going to mix a little bit of those shorter questions as well. There's one question here that I'm worried that I have had 2 vaccines and the booster is a different vaccine. Does that mean they're not compatible? I think we've touched on that before. No, that is a conscious decision. The booster is now currently either a Pfizer or Moderna, and they're pretty much equivalent. So Moderna, many people say, what's that? I've never heard it. But this is now, used a lot, and it's very, very effective, often used as a booster. And just to throw that in as well, there are currently 174 vaccines in development. You will see vaccines popping up and being ready there to be used and adapted to further variants. So this is not a static landscape. Can we choose what vaccination we have? No, you can't. It is largely around availability, what is your age, and what is your kind of underlying profile in terms of any potential contraindications. But most importantly, it's availability and the best available vaccine. But we don't have choice in that matter. The clinician will have some choice. And how long does immunity last after vaccination? So at the moment, we are saying as an indication, it's about 6 months. And some people say, well, I've been infected by the virus, so surely I am already, I'm immune. So what we do know now from observational real-life evidence is that the vaccine-induced immunity lasts longer and is more predictable. Because if you get immune through an infection, not everybody develops immunity, and that might not last as long. In fact, the observations show that it lasts shorter. So if you have had COVID, please get your jab. You still need to maximize your immunity. Let me just see if I've got one more. There's a lot of questions about underlying conditions and is it safe? So particularly people ask about varicose veins, and one question is about a heart condition. So in varicose veins, you are eligible, get your vaccination now, if you're in the eligible age group, of course. and a heart condition in the very, so those are the people, you are somebody we absolutely want to vaccinate because you have a long-term health condition that makes you more vulnerable. So yes, you are eligible, and please, go on the website, see where you can get it, and make sure that your immunity in the winter is maximized. Handing back to you, Tehseen.
Thanks, Ellen. I'll try and do a few quick round, conscious of time, and I do want to get through all the questions as well. So the question around the effectiveness of every vaccine according to ethnicity and age. So I touched on this earlier, that the trials recruited people from different parts of the world, different ethnicities, different medical conditions and different ages. So we know that actually the vaccines have been tested exclusively, and also in the real life data. So the fact, as I said, over 100 million in the UK alone. So absolutely has been tested. So you can be rest assured that that there's universally been tested on lots of different populations, and it's been found to be safe. And where there have been safety concerns, the vaccination programme has been amended. So again, pointing to the fact that we don't offer the AstraZeneca vaccine for those under the age of 40. The question about the housebound getting jabs at home. Yes, so as of last week, we rolled out the booster programme for those people that are housebound, and so you will be visited. We have a bit of a challenge at the moment because the vaccination centres are very busy, and because we have to observe people for 15 minutes, it takes a bit longer to get around and do all the housebound vaccinations, but we will get to you. If you are a housebound resident and you haven't had your first dose, then please call your GP and say you want your first dose. If it's your booster that you're eligible for, then we will get to you when the team goes around. We're doing it by postcode at the moment. And then the question around having long COVID, and when you had the second dose of the AstraZeneca made you feel much worse, the gastric symptoms came back and started feeling slightly better after that, but worried about having the booster. So I'm really sorry to hear that. I mean, that having long-term side effects like that is uncommon. But interestingly also, there was some evidence that having both doses of the COVID vaccine can help long COVID symptoms. But obviously in your case, unfortunately, you've had some side effects. But I would still recommend a booster, partly because it's a different vaccine for the booster. It's Pfizer, not AstraZeneca. And secondly, COVID itself is much more risky than not having the vaccine. And then just a couple of quick questions in the Q&A box. So you had your first vaccine in March, which was AstraZeneca, unable to get the second. Where can you go? So in all honesty, AstraZeneca supply has been limited, but we still have a few doses available at the local vaccination centres in both Bocking Street and also John Scott. And maybe at the end, I'll share those contact details for both the vaccination centres. So probably the easiest way would be to contact your GP or go to the national booking website and book yourself into either Bocking Street or John Scott and come and have the vaccine. We've got AstraZeneca there and we can vaccinate you. And then the other question on the Q&A is from PN saying, how long should it ideally be left between jabs? Moderna, Pfizer require 2 jabs. Are they better than 1 jab, such as Johnson & Johnson? Because you know someone who got COVID after being double jabbed with Pfizer. So very good question. So up until the JCVI guidance, the gap was 6 months. But actually that's been changed now, so it will be a 3-month gap. And the evidence shows, there is evidence for that either 3 or 6 months is absolutely fine. And we're erring on the side of caution to protect everyone for the new variant. And that's why the duration between the second dose and the booster has been reduced. And the other thing that, going back to Ellen's point, so remember that having the vaccine doesn't always stop you from getting COVID. So I know lots of my GP colleagues that have had both the vaccines and the booster, but still have been off with COVID. And the key point is that the main function, yes, it's to reduce the transmission of COVID, but the key thing about the vaccine is to reduce severity of the symptoms. So instead of you, for example, becoming unwell and ending up on intensive care, you might only get a bad cold or something that's similar to a bad cold, rather than ending up in ITU or even dying. So it's important to remember that. And that's also the reason why it's important to follow the guidance that Ellen talked about around hands, face, because you're not, even though you've been vaccinated, you're fully safe from COVID. Thanks, Ellen. I'll hand back to you.
Yeah, so I think it's important that we keep going back and back to these core principles around what this vaccine has been produced to do. And apologies if some found that boring, but it's really, really important to make sure you understand that. And that it kind of relates to some of the questions that are about, I've had 3 vaccinations, why do I need another one? And I kind of caused some concern the other day when I was talking to adult social care staff, when I said, with all likelihood, we are going to require boosters on a regular basis going forward for some time. And the people were shocked because they thought, oh, well, I'm doing the booster reluctantly, but then that's the end of it. That is unfortunately not so, because of the very facts that Tehseen just talked about. With this vaccination program, we're having a tool to kind of live with this pandemic. The other factor that we haven't talked about, nobody's asked it so far, is the global responsibility, because while we are privileged in some countries to have these high levels of vaccination uptake, other countries have none. They have no supply, and even healthcare professionals are, 1-2% are vaccinated. So there are still a lot of questions around what is our global response to living with this virus. So yes, to your question, you will require more further vaccinations depending on your underlying risk profile, underlying conditions. They may be earlier, they may then be called a third vaccination rather than a booster, because you have an underlying, you're immunocompromised, but your clinician will then tell you. The rest of us who don't have those underlying things will have repeated booster. And if you kind of consider what happens with the flu vaccine, because the flu virus is a very, very crafty virus, it constantly, very, very quickly changes its shape, internally, externally, all the time. So every year, and all viruses do that, but coronavirus is actually relatively slow. But that requires, for the influenza, for the flu virus, for every year we need to model a new vaccine to get some protection. But still, that might not be in the public domain so much, but it is actually, if you look for it. Mortality from flu every year, particularly people with underlying health conditions, is actually really high. It's thousands of people. So, but the concept of repeated vaccinations to reduce mortality is not new. It's just that it's now so much in your face because everybody's talking about it. Just a question here, who can take responsibility for the side effects of the vaccine? So if you take the vaccine, or in fact any health intervention, you do take a small risk, but you go into that situation on an informed basis. And everybody will tell you there will be a sore arm with all likelihood. You may feel rough, particularly if you have had your first jab already, or a kind of infection-induced, virus-induced infection. When you then put another tiny dose of this antigen in your body, you will have side effects. And some, as you said, some might have very rare allergic side effects. And I don't think there is a kind of responsibility issue here. It's a choice. We are not in a country where this is a mandated thing. You can choose whether you want to take this or not, but please do this on an informed basis. Look who's in the hospitals, look what kind of freedoms we are allowing ourselves. We've been able to live last year until very recently, and how we are finding our way to a position where we can actually live with this virus. Just see if there's any, I can't see any other short one. Can you see anything, Tehseen? Yeah, probably in the chat. Why is Astra not offered as a booster? Because evidence shows that Pfizer or Moderna is more effective, and also the combination Astra and then something else as a booster. There's increasing evidence that this kind of crossing, so the different products, boosts immunity in itself. So these are kind of, we're learning as we go along. We've been playing with interval. So initially interval was 3 weeks. Then we realized actually 8 weeks and beyond is more effective. But it's always finding a compromise between protecting maximum people from dying, frankly, or being severely ill, and having acceptable levels of pressure on the health system, who, people have to give those vaccinations. And so it's always a striking a balance. I'll hand back to you, Tehseen. Can't see anything right now. There's something else just now.
Thank you, Ellen. I think actually your last point perfectly answers one of the questions around this question is, they told us the science is settled by getting two jabs, it's the regular boosters. What happened to the science we were told to trust? And you answered it really beautifully there, that science isn't a constant thing. Science is about experimenting, testing, learning. This is a new disease. The actual vaccination technology we've known for a long time, and we're learning as we go along, and things are changing as we go along. Yes, I can understand from from the public's point of view, actually, sometimes that change in guidance, actually, it's quite normal to feel nervous about that, because suddenly the message changes. For example, and this was a key thing at the start, we weren't vaccinating pregnant women. And then suddenly it was decided that we are. And a lot of pregnant women were worried by that. Well, how have you suddenly changed the guidance so quickly? And that was because it was unethical to test on pregnant women in the trials. But what they found was in America that lots of healthcare professionals who took the vaccine happened to be pregnant at the same time, and they didn't have any bad consequences of the pregnancy. And so because of that, because of the tens of thousands of cases there, they deemed Pfizer to be absolutely safe in pregnancy, and that's why we use it routinely. So science does change, it doesn't remain constant, and that's healthy, that's normal. And we follow that scientific principle according to, exactly as Ellen says, what can protect the public most of all. The other question was around having a compromised immune system being required to shield for the past couple of years, having the booster vaccine, but feeling confused as to whether it's considered to be a booster or a third, and which one is it? Is it a third or a booster? I think, again, Ellen probably did touch on this, that actually for immunosuppressed people, they are eligible for a third dose and then a booster. Initially it was 6 months, but now actually they're eligible for a booster 3 months after the third dose. So for a lot of people, actually they'll be getting their fourth dose who are immunosuppressed. So you'll be eligible for that if you've got immunosuppression. But again, for that specific piece of advice, do ask your GP, because it depends on your underlying health condition. And the second part of that question is, in light of the Omicron, having the two vaccines were AstraZeneca and the booster was Pfizer. Will the fourth vaccine be Pfizer? Yes, it'll either be Pfizer or Moderna that you'll be offered. And then the other one is around, a very quick one around the booster jab being recorded for travel on the EU COVID pass and the NHS pass not showing that. That's probably a digital app issue, or it might be that you've been vaccinated abroad, and currently there's lots of issues around putting that into our system. Now, we've been told that there is a national solution to that will be made available soon, so hopefully that will resolve it. But if it isn't a case of you being vaccinated abroad and it's just a digital thing, again, talk to your practice, because sometimes it can override that, and we've done that certainly in our practice in particular cases. And just again to address some of the questions, yes, absolutely, we're saying mask, social distancing is still necessary despite having the vaccine, because as I said, you can still pass on the virus. And then the other point about COVID being mild, yes, actually, in a lot of children, for example, in younger people, COVID symptoms can be mild, but exactly as Ellen said, in some people it can cause long COVID. And importantly, actually, vaccination and transmissible disease isn't just about yourself. It's about the risk that you pose to your friends, to your family, to the elderly living in your, and the vulnerable living in your community, which is why, going back to the point in Hackney with so many unvaccinated people, why we're so concerned about this and actually getting people protected as quickly as possible. I'll hand back to you, Ellen.
I just want to pick up on one thing. Olga, you have to stop us if we have to stop, but there's so much food for discussion. I just want to pick up on one sentence. And that's about variants and they becoming more aggressive or, you know, less so. So why viruses mutate is because they are finding, you know, they want to find a genetic advantage. Yeah, so that's why they're mutating. And so they want to be able to infect more effectively the host, any host. The hosts are often not limited to human beings. They can be other hosts too. And it is actually, there is no particular pattern to, you know, whether they're more aggressive or not, but I don't think they're always less effective because the underlying reason is they're trying to be more effective in infecting. So if the levels of immunity of the host are not effective to this new variant, then the virus has won because it has a new reservoir, and that may and often is expressed in another illness and often also severe illness. Because if you have an immunity, you basically prevent yourself from getting ill in it. So it is. I don't think that is what kind of the learning, and of course the kind of, we have considerable learning. As a public health consultant, I can tell you that vaccination is probably the one really big win for public health, a second to sanitation, because it has saved millions of lives. So our children are, and ourselves were getting tetanus and measles vaccination, and that prevents people from dying, as clearly as that. So it's one of the biggest wins for public health, for humanity. Let me just see, there was something flashed up. I'll just see, that's in the chat.
Whilst you're having a look, Ellen, there was one actually that I realised that we might have missed. It was one of the earlier questions around being allergic to something in the Moderna vaccine causing chronic hives. Could you have a second jab that wouldn't cause a reaction? Again, yeah, it's unfortunate. I'm sorry that you've had side effects. It is quite rare to have persisting side effects from the vaccine. And I always say to residents that actually when you have a vaccine and you have side effects, that's almost a good sign because it's showing your immune system is responding and producing antibodies. Depending on how severe the reaction was and how uncomfortable you feel about having the same second vaccine. I mean, overall, the advice probably would be to still have the second dose that's Moderna. But if you feel really uncomfortable about that, we'd rather you have the second dose, even if that was a different vaccine, so Pfizer, for example, rather than not have the vaccine at all. So there is allowance for that, and the guidance is clear. So again, in your case, please talk to your GP because we can, I mean, I've done this for patients where there are exceptional circumstances and it means that we're not going to fully vaccinate someone, then actually we can request a different vaccine. But it might be that with a bit further discussion that you don't necessarily even need a different second vaccine. Sorry, Ellen, I don't know whether you found the question that you were going to answer.
No, I don't think I found anything else. I think that was the one we skipped. I can't see anything else really.
There was just, I think you might have answered this around the jabs to children and the justification for that one. There's no longer studies, and again, you know, with children, it's the spread to other members within the family and the community, exactly as Ellen said. So those countries where they did vaccinate early, actually they saw lower rates of infection. And just the last point about COVID deaths being counted in a manner that inflates the numbers. Again, this isn't the case. So the death rate is based on those people that have had a positive COVID test and the 28 deaths preceding their death. And, there might be odd cases where it actually isn't directly related to COVID, but most of the time it is related to the COVID infection or the impact that's had on their secondary medical condition. So the data is accurate.
So I just wanted, from my perspective, particularly because Tehseen is, a clinician, and I'm not. I used to be, but I'm in a public health position. I just want to say thank you to all these clinicians out there who are spending so much time actually giving vaccinations. This is staying with us for the foreseeable future, and it makes life livable to a large extent. So, and it's thanks to all clinicians and staff, really providing the vaccine. You can't imagine, obviously, if you read the news, you can, what a historic effort that is. And our expectations, as we've kind of talked you through now, are actually quite modest. It's preventing death, severe illness and hospitalization. That is actually quite modest. So this is a severe crisis we're in. It's not like polio, where we were near eradication, global eradication. The key comes up as sort of where you have a vaccine that can actually make sure that the disease is no longer existing. This is unlikely to be the case in the foreseeable future with this COVID-19. So that it is a serious situation we're in, and thanks to our combined efforts, we are kind of able to navigate this crisis.
Thank you, Ellen. And yeah, I also want to thank everyone really. And I think you said it right. It is a combined effort. I think the public health team has also been so instrumental in rolling this out. And the kind of insight that you've provided. But also, I've never worked so closely with colleagues in the council, with the voluntary sector, with community champions, with residents. And I find that really exciting. So COVID has been awful. The vaccination programme has been positive. But what I'm looking at is the next step. So going back to what I said, what can we learn from the vaccination programme and apply to other principles? And I would hope that these kind of dialogues between residents and medical professionals, public health consultants, and the wider community can happen for other conditions. So whether it's diabetes or cancer screening, etc. So I think this is a pivotal moment when we're talking about how to deliver healthcare. So thank you to everyone that makes this possible. So we're wrapping up now. So if people have specific questions that we haven't answered, I think we've gone through all the list. I did have a double check, but just contact your GP for advice. And if there's general inquiries about the vaccine, you can email testandtrace@hackney.gov.uk. And then we'll send an email in the next few days with a link to the recording and links for further information and where to get the vaccine. So we'll share the local vaccination centres and any other information that you might need. So please send us an email if you want specific information. And thank you again for joining us on behalf of both Ellen and I. Goodbye and have a good evening.
Yeah, thanks for me too. And thanks for your kind comments in the chat. And thanks for all the questions. Bye.